Good morning to everyone, and today we ask for permission to be without our robe, Hector without the suit, and Gisela also with her our T-shirt, because today is a day that for all Cubans and all workers is a day of great joy, which we began by singing the notes of our national anthem, and then each in their activity with the conviction that together we will win. The health workers and all those who work, we will be able to achieve the results that we are striving for. We begin today the information with the unpleasant news and conveying our condolences to three families, three groups of friends and others for the death of three people yesterday. We have to say that one was an 86-year-old male Cuban citizen from Havana, specifically from East Havana, who had a history of high blood pressure, ischemic heart disease, a chronic brain disease, who had been admitted to the hospital and was undergoing intensive care. He presented a group of complications that made it impossible for him to recover from the shock he suffered yesterday, which caused his death. Our condolences. The other person who died yesterday is a 58-year-old male patient, also from Havana, with a history of alcoholism, and he presented a respiratory condition and complications that evolved very classically. And in a matter of a few days, practically in hours, we had to mourn his death yesterday. And the third person who died yesterday was a 72-year-old male Cuban from the province of Havana, specifically from Old Havana, with a history of high blood pressure and diabetes mellitus, who was admitted. He presented a group of complications. He was taken to intensive care. Unlike the two previous patients, by noon yesterday, he made a cardiorespiratory arrest from which it was not possible to recover, despite the resuscitation maneuvers that were made at that time. And we reiterate our condolences to their families, to their friends, and to those close to them, and we are very sorry that these three people, despite the efforts of our workers, could not be saved. The situation in our country allows us to say that a total of 2,062 samples were processed yesterday. Notice that we have already processed, I think for the last 2 or 3 days, more than 2,000 samples, and we would like to emphasize this because this is one of the goals of our program, to reach more and more people, to do the tests, to be able to detect the presence of carriers or people who have the disease and even had no symptoms of it. The largest numbers of samples were processed at the Pedro Curie Institute of Tropical Medicine for 765. The Molecular Biology Laboratory in Santiago de Cuba province processed 466. The Havana Laboratory 407, the Villa Clara Laboratory 207, the Genetic Engineering and Biotechnology Center 188, and the Brother Ameiras Hospital a total of 29 samples. Of the 2,062 samples that were processed, 36 tested positive for COVID-19 SARS-CoV-2, a 1.7% positivity of the processed samples, similar to yesterday's. In this way, Cuba has already accumulated a total of 49,409 samples, and 1,537 positive samples, confirmed patients, for a 3.1% of the samples processed. Of the 36 new confirmed cases, all were Cubans, of which 31, that is to say 86.1%, are confirmed cases contacts. And we add today a data that also our population that is very attentive to the evolution of this disease and is asking about this. We say that the evolution of this disease, we have already said it, that of the 36, 31 are contacts of confirmed cases. But of the 1,537 confirmed cases in our country, 85.5% of the cases studied are contacts of confirmed cases. In 5 of the 36 new cases, the source of the infection was not specified, and also, as I said yesterday, out of a total of 192 cases that we have had without specifying the source of infection, 57 remain. Initially, we don't have the source of the infection, but after the control of the outbreak, the objective of all this is to find everyone who has the virus in our country in order to isolate them, treat them, and prevent them from getting complicated, and on top of all that, preventing them from continuing to spread the disease. Of the 36 cases diagnosed, 29 or 80% are male, and there are already 768 men who have had the disease in our country, that is for 49.9%, and 7 with a cumulative of 769 or 50% are female. 66.6% of the positive cases were asymptomatic. That is, of the 36 yesterday, 24 were asymptomatic. This brings the total to 673, which represents 43.8% of confirmed cases. Of the total 36 cases diagnosed, the age groups most affected were those between 40 and 60 years of age, with 44.4% of the diagnosed cases, and those over 60 years of age with 13 cases for 36.1%. The most representative provinces are Havana, with 29 cases, that is 80.5%, Matanzas and Santi Espiritus with 3 cases each, and Villa Clara with 1 case. Of the 1,537 patients diagnosed in our country, 747 show a stable clinical evolution. This accounts for 98.7% of the patients diagnosed, without taking into account the deceased and those who have been evacuated. So we can say that 98.7 have a stable clinical evolution. 2 people were evacuated, as I said before, and with the 3 deceased today, we regret that 64 people have died. That gives a lethality of 4.16% of the confirmed cases, something similar to previous days. And already today there are a total of 714 people who have had the disease and who have been discharged, 33 of them yesterday. That gives 94.3% of active cases. I reiterate, removing the part of the dead and of the evacuees, the people who are already discharged in our country, from the total of confirmed cases. In terms of the patients in critical and serious condition, today the figures remain the same because there are 6 critical patients and 4 in serious condition. We can say that until 12 o'clock at night in Havana, remember that all the information I give here corresponds to the 12 o'clock cutoff time, there were 2,000 897 patients admitted to the hospitals in our country. In surveillance, 30 suspects, 2,110, and confirmed 757. 3,892 cases are being monitored by primary health care. With regard to migratory movements in our country, there are 11,300 visitors, of whom 6,711 are immigrants and 4,590 are foreigners. A similar number of foreigners are staying in rental houses, and they remain practically unchanged and are mainly to be found in Santiago de Cuba, Centro Habana, Plaza and Playa in Havana province. We said that the lethality in Cuba has been at 4.1, and there are actually a significant number of countries in the Americas, in the American region, that have higher rates. The most significant are, as we said yesterday, are Barbados and Bahamas with 3.8%, Guyana with 10.3%, Antigua and Barbuda with 12.5%, Suriname 10%, United States with 5.86%, Brazil 6.99%, Canada 5.81%, and Mexico 9.63%. In short, of the 35 countries in the region, 12 have a fatality rate above the average rate for the Americas. 183 countries in the world are with the presence of COVID-19, and the figure of 3,130,800 confirmed cases. In just one day, 78,430 were confirmed, and worse still, 227,051 have died. In just one day, 10,488 and a rate and a lethality of 7.25% higher than yesterday. The region of Americas also has a very alarming figures, with a total of 1,293,607 confirmed cases, 41,006 in a single day. That is 41.32% of the total number of reported cases in the world, and a total of 74,591 deaths, 3,500 deaths in a single day, with a lethality of 5.7%. Yesterday we saw some images published in Russia Today. We saw a field that had been removed and with many bodies in their coffins, placed side by side, belonging to the state of the Amazon in Brazil, whose capital is Manaus, where the figure of fatalities is very alarming. And the funeral homes and cemeteries are not enough, and they have been creating these places for burials. And this is something that is not exclusive to Brazil. I say this because there are other images that we've seen about refrigerated trucks filled with corpses in New York. I reiterate, COVID-19 is a very dangerous disease that we cannot trust at any time, and that has the world in check, because it is very difficult to control, as it has been demonstrated. The following question is sent by the Grandma newspaper, and it says, the United States has launched an outrageous crusade against our doctors and their altruistic work. What do you think distinguishes the work of our healthcare professionals that denies all these absurd manipulations? Well, I think that this is part of the manipulation that the American government does against the revolution. There are many examples, but I think that in the altruistic example by our health personnel in the internationalist missions, going to places in the world where no one goes, this is something that should be considered. I was leading the mission in Angola for 3 years. That's why I can talk from experience. Besides being in distant places, they were in Africa during the Ebola pandemic, risking their lives. Now, currently, they did not hesitate to take the step forward, and we have been aware of a number of brigades that have gone out to fight COVID in different countries. Of the first groups that left, they were specifically, they left for the Lombardy region in Italy, which was one of the regions that had the most numbers of confirmed cases and deaths at that time in Europe. And I believe this humanism is a characteristic of our health system and of our revolutionary system, and that is internationalism. Today we can say that we have health worker professionals working in 65 countries around the world, and that we also have 25 brigades of the Henry Reeves Brigade, which are contingents that prepare for emergency situations in order to confront disaster situations around the world. They have had an exemplary record attending devastated places. Let's remember Pakistan, let's remember many places in the world where our brigades have been, and I reiterate, what is being said about them is pure manipulation of information.